Welcome to Totally Woman Podcast. Totally Woman is a bi-weekly podcast that uncovers essential health knowledge and highlights inspiring journeys that transforms women's lives. I'm your host, Rosemarie Crosdale, a licensed adult gerontology nurse practitioner, and this season, we want to hear from you. Hello, everyone, and welcome back to the Totally Woman Podcast. I am your host, Rosemarie Crosdale. I am a registered nurse. I'm also an adult gerontology nurse practitioner. And as you may know, if you have been listening to this podcast, this is the Totally Woman Podcast. If you've been listening, you know that women's health is my passion. And this podcast is dedicated to educate. We share knowledge about health and wellness, as well as celebrate and empower every woman while honoring the beauty in each of us. We are fearfully and wonderfully made. Yes, that's what we are. Our makeup is exceptional. And ladies, before I even go any further, I just want to take this opportunity to thank everyone for your continued support. Thank you for listening. Wherever you listen to your podcast, whether you're on Apple, iHeartRadio, or Spotify, thank you so much for listening. I really do appreciate you. To all the people who are new to this podcast, I want to welcome you back. So thank you so very much. And I really do appreciate you. The time goes by so fast. It's so crazy how time is moving. We're more than halfway into the year and it's just counting down. By the time you look, it's going to be like Thanksgiving already, and then we'll be talking about Christmas. But on this episode today, I just want to focus a little bit more on like health and wellness, right? I want to talk about health and wellness. Just prioritizing your health. I know it's been the summertime. Some of you are busy moms. You've been taking care of the kiddos while they're out of school during the summer. Some of you have been traveling. You've been doing just all sorts of things because it's the summertime, and why not enjoy your summer, right? Vacationing. I hope that you've gotten the chance to just do something for yourself, whether you've traveled out of the country or whether you are staying local, just enjoying the sites that, you know, your surroundings or your area has to offer. This is just something that is very good. Just getting outdoors and just doing some outdoorsy things. Restaurant week was a while ago, I think maybe a couple of weeks ago or something. So even just enjoying things like that with your friends, with your family, with your loved ones, that is what it is all about. But sometimes with all that busyness, right, with everything that is going on, as usual, ladies, we are usually left on the sidelines, right? We're not necessarily taking care of us the way that we should do. And now that we're more than halfway during the year, I want us to start to even just thinking about prioritizing our health now, especially before the back to school year starts back. I know some places already in the country, depending on where you are, some students have already started school. But, you know, before I even get into the meat and potatoes of this episode, I really just want to touch on just something that has been in the news lately. And I just wanted to talk about Legionnaire's disease. Legionnaire's disease, we've seen where just right here in New York, there's been like an outbreak, and I'm not sure of the actual number of how many people were actually exposed to it. But you may have heard about this recent outbreak, and I just wanted to talk to you a little bit about that. Legionnaire's disease, for those of you who may not know, is a severe form of pneumonia. And this kind of pneumonia is caused by the Legionella bacteria, right? Hence the name Legionnaire's disease. And the way you contract Legionnaire's disease is that you get it by inhaling the mist or a vapor from water systems that contain the bacteria. It's not something that you can spread from person to person. Like you coming into close contact with someone, it's not spread that way. It's spread maybe through air conditioned system, heating systems, if you're inhaling that. And the people who are at highest risk for contracting this are people who are already compromised. And you may not even have to be compromised, but you have a weakened immune system that puts you at risk. If you're over 50 years old, if you're a smoker, if you have chronic lung disease, right? These are things that will cause your risk factors of contracting this disease, especially in this form of setting. Your risk would be much higher. And some of the symptoms, some of the symptoms are associated with, you may think that you're experiencing the flu because some of the symptoms are flu-like, where you will have fever, you'll have a cough, you get the muscle aches and the fatigue, some respiratory issues, maybe you have some shortness of breath and stuff like that. And I just wanted you, if you're in certain areas of New York where I know people stay very informed. The New York City of Department of Health has information on this, so you can always go to their site and also check that out as well. And just to be aware of these respiratory issues, monitor these respiratory issues, especially if you're immunocompromised, right? These are ways for you to protect yourself. So sometimes you may think that you're just having the flu, but if you're suspecting that something, and we know our bodies, right? Ladies, and this is not just something affecting ladies, it can affect anyone. We want you to just pay special attention if you're experiencing any one of these symptoms, or if you're immunocompromised with any of the comorbidities that I spoke about, like if you're a smoker, you have lung disease and those things, chronic lung disease, any issues like a COPD, chronic obstructive pulmonary disease, if you're an asthmatic. All of these things are issues that can affect your lungs. So in those cases, you'll be very vigilant about the signs and symptoms if you start to experience them. And very important to follow up with your primary doctor. I always say that the information that I'm giving here, yes, I'm giving information. I am a nurse practitioner and I'm providing information, but I'm also not directly treating you. So I want you to make sure that you're following up with your primary doctor as well. Okay, so that is something that is worth looking into, especially now that it's something that is affecting our area here in New York. Okay, so just that was just an FYI, just so that you guys can be aware of what is happening in our surroundings, right? So just getting into it right now. When was your last physical? When last did you have your physical done? And I know that sometimes talking about vaccines, immunizations, all of those things, sometimes so much fear is put into people that they're so scared of seeking help, of getting vaccines, because a lot of times you're told that these things it's going to make you sick, it's going to cause all sorts of things to happen to you. And because of that, a lot of times people shy away from getting vaccines or from getting their children vaccinated as well. But vaccines are there to protect us. They protect us from getting the disease, right? And these are why the vaccines are there. And it's very important that you weigh the pros and cons, because that is all that I can do. I can provide you with the information, and based on this information, you're going to make a decision, especially when you talk to your doctor, if these vaccines are important, or is it worth getting immunized, right? So since we just talked about the Legionnaires, let's talk about the pneumonia vaccine. So pneumonia vaccine, we're talking pneumonia vaccines right now since I'm talking with women, if you're 50 and older, 65, the pneumonia vaccine, we recommend that you do get your pneumonia vaccine. So that would be a vaccine that you would be getting, and that will help to prevent against pneumonia. Also for people who are immunocompromised. I know it's a big stigma with the flu vaccine, but I feel that if you're immunocompromised, getting the flu vaccine it's worth getting, right? But some people believe that they can take other precautions. And if that works for you, then fine. But if it doesn't, I will encourage you, if you are 60, 65 or older, these are the recommendations that they're making in terms of vaccines for your age group, right? And these are ways that you can just monitor to make sure that you're not getting the disease. And that's what vaccines are there for. Okay. We're also talking about the Tdap. Tdap is available. It's important during every pregnancy. And also, you can get a booster for the Tdap every 10 years, right? So, this is another protection. The MMR, which is the measles, mumps, and rubella, that vaccine is a live vaccine. So that vaccine is not given during pregnancy, right? We do not give the MMR during pregnancy. But if you can get it before you're pregnant, once you're not pregnant, you can get that vaccine. Okay, we've also heard about different areas where measles now, there are areas all over this country where measles are on the rise again. And these are vaccines that can protect us from that. The varicella or the chicken pox, the varicella vaccine for those who if you've never had the chicken pox, right? That would be the vaccine that you'd be getting. Also, for women who are 50 years and older, then the recommendation would be the shingles vaccine. So if you're 50 or older, and you've been exposed to chickenpox, you would definitely be getting the shingles vaccine. Hepatitis B is recommended for adults who were never vaccinated, especially for certain risk factors, like you're sexually active, you have multiple sex partners, different things like that. We do recommend the hepatitis B vaccine. The hepatitis A vaccine is just like for a lifestyle, especially for those people who are traveling. That vaccine is recommended as well. Okay. So those are the vaccines that I would talk about for people, for women. And if you want to make sure that you have built up like immunity, right? If you're not sure if you need to be vaccinated or if you're not sure of your immunization status, what you can ask your provider to do is to draw what we call titers, right? And when they draw titers, they will check you for the MMR, they will check you for the Tdap and all of those things. And then if you have immunity to them, then you wouldn't have to get vaccine again. But if you don't, if you've not built up an immunity, then that would mean that now you would need to be vaccinated, right? So let's talk about one of the other vaccines that can be given, and this is called the HPV vaccine, right? The HPV vaccine is the human papilloma virus. That's the HPV vaccine. And that vaccine can be given as early as age 9. That vaccine is not just for girls, it's also for boys. It's also for men, right? So women and men can get the HPV vaccine. Because what does the HPV vaccine does? The HPV vaccine prevents a list of different cancers, including cervical cancers, throat cancers, and oral cancers, right? This is the recommendation for the HPV vaccine. And this is why we recommend getting the HPV vaccine. The most important thing to remember, the HPV vaccine is about protecting against cervical cancer and other HPV related cancers. Like I talk about the oral cancer, anal cancer, those are HPV related cancer, and prevention is always better than treatment. So if you fall into these categories, and sometimes people say, I'm very healthy, my immune system is very good, I don't need the HPV vaccine. And one of the things that I also want to let you know is that HPV is not just through you don't get HPV just through sexual contact. You can get HPV HPV through even just skin to skin contact, touching, kissing. These are ways that HPV can be transmitted. So even if you have your healthy child and you know that they have a good immune system and they're doing well, they're coming into contact, especially your teenagers. They're now either they're in high school, they're in junior high school, high schoolers who are going off to college, they're living in dorms, different things like that. We do recommend that having the HPV vaccine is recommended for this age group. Okay. The HPV vaccine is now given even up to people in their 40s. Sometimes they say that getting the vaccine that late, it's probably not going to be doing anything significant, but some studies have shown that it has helped. Another thing to take away from that too is that some of these people, if they're not maybe what we would call high risk, then getting the vaccine that late would probably be beneficial to them, right? So HPV, it doesn't always require intercourse. I'm going to say that again, just to give you some highlights when it comes to the HPV vaccine. And this is not to force anyone, but this is, like I said, the information I'm providing is just to encourage you and to give you the information so that you can make an executive decision for not only for you, but for your family. This is where the term health is wealth come in, because if you don't have your health, you don't have anything else, right? So HPV, like I said, it doesn't always require intercourse. It can spread through skin to skin, genital contact. The more partners you or your partner have had, the higher the chance of exposure. All right. Many people also carry the HPV virus without even knowing it. Right. And that's why it can spread so easily. So it can be in your system and you don't show any signs or symptoms of it. Right. And that is why another thing that is recommended, once ladies that you're age 21, this is when you can get your pap smear done. And what does the pap smear do? When you do your pap smear, what it does is that they take a swab of your cervix and they check those cells as well, and those cells will show if there are any changes in the cells, and that can show if you're at risk for also getting cervical cancer. So having the HPV vaccine, you should also be doing your pap smear. And your pap smear is usually done at age 21. That is the first time that you usually have your pap smear done. Okay, so just to recap, the HPV vaccine, it's given as early as age 9. It can be given. And yes, you may have your healthy child or your healthy young adult, but remember that we're living in a society where people are intermingling. They're mingling at school, they're touching, they're kissing. And even though they're very healthy, they can still be exposed to the HPV virus. Okay. So just so you guys are aware of that. Other things that I want you to be aware of as well, and certain blood work that I want you to also be focusing on as we're getting older. Some of these blood work that I want you to do, and even just getting your physical. We should be getting a physical annually, right? We should be getting our annual physical where we're checked for our blood pressures or A1C. That is another blood work that is done, the hemoglobin A1C, because this will tell us if it's going to be screening for diabetes or if you're pre-diabetes, right? Blood work can also be checking your vitamin D level. Low vitamin D is very common in women. It's common overall sometimes across the board. Even though we think we're outside and we're getting a lot of sunlight, sometimes we may still need vitamin D. So we can have our vitamin D levels checked, because vitamin D will affect our bone and our immune health, especially as we are in our perimenopause and our menopause stage. Another important blood work that we should be getting is our thyroid function, right? Especially in women, we have hypothyroidism, or we could have hyperthyroidism. hypothyroidism. So hypothyroidism is more called, you will hear the terminology, probably Hashimoto's disease, where sometimes it's difficult for women to lose weight and stuff like that, some of those things. So what they would be checking is your TSH level, your T3 and your T4 levels. Hyperthyroidism now is an overactive thyroid. So now sometimes the woman may experience some palpitations. Sometimes you may experience, sometimes you see that bulging in the eyeballs and stuff like that, and also losing weight. So ladies, if you're noticing that you're having unexplained weight loss, things like that, it's worth following up with your doctor and having your thyroid function also checked, right? Doing a lipid panel. A lipid panel is what is going to tell you about your cholesterol, your triglyceride. These are things that can be a precursor to heart disease. So having your lipid profile done is very, very important. Also, C-reactive protein. C-reactive protein, this is sometimes linked to inflammation, and it can also be linked to heart disease as well. So you should have your C reactive protein levels checked. A CBC, which is a complete blood count, is what is looking at if we're anemic, anemia and immune issues, right? Some women who are experiencing issues with fibroids, these can cause you to have anemia, where your blood count is going to be significantly low. Another thing that they can also check is your ferritin level. Because what is your ferritin level? Your ferritin level is your iron storage level. So if you have those levels checked, those levels will also show if you're like anemic, and some of you may need to have IV ferritin as a treatment, or you may need to be on iron supplements, or sometimes just having foods that are rich in iron. But sometimes, even though we're eating like our vegetables and our dark leafy greens and stuff like that, sometimes by the time we either cook them, eating them raw sometimes is much more helpful, but sometimes by the time we cook them, a lot of the nutrients are already gone. So sometimes you would need to be on supplements to help with your iron level. Like I said, especially women, if you're having your menstrual cycle, some of you are having issues with heavy menstrual cycles, please make sure that you're checking with your GYN also. At some point, I'm going to be talking about uterine fibroids. That's going to be coming up at some point. I don't know on which episode as yet, but it's definitely worth the conversation. So we'll definitely be delving into that at a later time. But understand that having your complete blood count check, your ferritin level, these are things that will show if you're borderline anemic or if you are anemic, okay? Having what we call a comprehensive metabolic panel. This is what look at our electrolytes, our liver function tests, our kidney, which is like we are looking at our creatinine levels, right? Where those are the levels that we're looking at for our kidneys. Our electrolytes, we're looking at our potassium or sodium, our magnesium levels. This is the blood work that you should be asking for, that is going to help to guide you to be better informed. So when you do have your physical done, and this is an annual physical, these are some of the recommendations that I would have you have your primary provider do for you. Very, very important, just so that you know your status and that you will know how to proceed and what other tests that you would need to have done, especially for women going through menopause and perimenopause. A lot of these tests, routine tests and stuff, blood work and all of these things are very important, especially at this stage in your life. So I definitely recommend that you talk to your doctor about it. And even as you get older, is even getting a bone density scan done. I had one of those done. It's nothing to it. I thought I thought it was something so much more than what it actually was. But a DEXA scan is what it is. It's not a blood test, but it's very important. Bone density, because as we get older, if we're not doing exercising, doing some strength training and those things, our bones can get osteoporosis. This is what it's going to be telling us. Our bones can get weakened and stuff like that. So we want to make sure that we're taking that into consideration to make sure that our bone health is doing well, right? So these are the things that we're going to be asking for when we get our annual physical done. And like I said, there's no time like the present. It's more than halfway through the year. I know you're busy. You're doing what you're doing. You're trying to get the kids ready for school. You're doing all of that. Some of you are still traveling, enjoying your summer, enjoying your vacation, as you should, right? But at some point, ladies, we have to take stock of our health as well and prioritize these things and getting them done. So these are some of the things that when you go back to your primary doctor, or if you have a nurse practitioner or someone that you're seeing, is that you definitely get these tests done if you've never had them done, right? And some of the screenings, if you're 50 or older, you should have already had a colonoscopy done, right? You should also be getting your mammogram. These are tests and screenings that we should be doing over the lifespan, right? So I just want to encourage you, ladies. I know it's a lot, and I know sometimes just even making the appointments, fitting yourself in, but you have to, right? Because if you're not here, then you're not here. There's nothing that you can do. Your health is your wealth, right? Having your health is very, very important, because what does this do? This allows you to be able to take care of not only yourself, but to take care of your family and those that are around you, that some of us, we're in charge of these people. And even if you're not, you should still be prioritizing these things. So let us prioritize getting our physical, getting our immunizations updated if you have not done so as yet, and different diagnostic tests, right? I don't want you guys to be nervous or fearful, because a lot of times a lot of fear is put into you. But these are things that we should be doing, right? We should be doing because we want to maintain our optimal health. And the only way we can do that is if we get our screenings and we get our physicals, we get our immunizations and we get our vaccines, all these blood work and stuff that we need as well, is getting all of these things done. I know it's a lot. I know I gave you a lot of information. And like I said, make sure that you are following up with your primary doctor, or for those of you who have a nurse practitioner, whoever your provider is. And another thing that we did not talk about, ladies, is that we did not talk about our sexual health, right? If you're sexually active, HIV, syphilis, gonorrhea, we see in practice now where some of these STDs are on the rise. And ladies, one of the ways that you can protect yourself is by using condoms, right? Condoms are not just for birth control, just to use as a form of birth control, but condoms can be very effective if used properly to also prevent STDs. So, be very good to yourself. Know your status. Know your status. Ask to have your blood work done. For those of you who, if you've been in a relationship, if you are entering into a new relationship, if you are dating, I don't see, and especially if you're just dating, then that's something different, right? Depending on how the dating scene is seen nowadays, because I'm kind of out of the loop myself. But whenever you feel the time, and if you're going to be intimate with someone, then it behooves you, because this is your body and this is a way for you to protect yourself. And one of the best ways that we know how is to protect yourself by using this form of protection. And I feel like this is worth a conversation with your partner to talk about, to know their status. And if someone feels uncomfortable, then you should feel uncomfortable in exposing yourself because you don't want to end up with an STD. Some STDs, yes, some of them are treatable, but some of them are not. Like HIV, there's no cure for HIV. There's no cure for syphilis, right? For gonorrhea, you can get a shot. But even then, if these things, if left untreated, they can lead to other issues later on down the line. So just to be aware of that, ladies, I want you to make sure that you're also prioritizing your sexual health. Okay. This is also a part of your wellness visit. If you have not done so already, just understand that if it's not a part of your wellness visit, you then should make it a part of your wellness visit. All right. Put yourself into the mix and get everything that we need to get done, right? You are not alone, right? And this conversation is not about judgment. This is about understanding and providing the information that you need in order to empower you to get you to your optimal health. I want to thank you so much for joining me on this episode. This is actually episode number 4, right? We're 4 episodes in, and this is season 3. And I'm so appreciative of you being able to join me. And like the Totally Woman motto says, continue to motivate, continue to inspire, and continue to uplift each other. See you next time. Totally Women Podcast is hosted by Rosemarie Crosdale and powered by Indie Creative Podcasts.